Inspire Movement Physical Therapy. In this video, we're going to show you a stretch. It's derived from the pigeon pose in yoga. It's to stretch the piriformis muscle and the hip as well into more flexion, the ability to bend up at the trunk. We do have videos that are specifically geared toward the piriformis muscle, and we also have videos on how to treat that clinically. And I would encourage you to check those out if that's something that you're really concerned about and focused on. This is also going to get at that. It's a little bit more aggressive, a little bit higher level, but if you're not dealing with super acute pain and you're looking for more wellness and maintenance, this is a great thing to add into the routine. First, let me just kind of show you what the pigeon pose looks like. Now, I do not have terribly flexible hips, so this is a good thing for me. And first, let me demonstrate that. So when I lie on my back, I do not come up terribly well, okay? Right here is about where things stop, and if I try to pull harder, it gets a little bit pinchy for me. So that is an area of restriction in me. We're going to come back and take a look at this after the stretch, because this typically helps me a good deal. For the pigeon, what you're going to do is you're going to cross this leg over. Ideally, the shin is touching on the mat. You're going to see that I can't do that, but that's the ideal. And you're going to bend the knee a certain degree. If you can have it at 90 degrees, good for you, but for me, I have to bend it a little bit more. And you have that knee kind of right in front of your chest. I have my back leg straight back. I'm not letting it slide out to the side. Everything is pretty much on a track here, okay? It's having that back leg in line that kind of keeps us honest. I have my back leg going straight back. I'm not letting it go out to the side. I'm kind of keeping everything on track. And again, my goal is to be able to have this all way out here and still be able to go down, but I can't really sink into this, so I need to bend my knee a little bit more. But basically the goal here is to stretch the hip up by sinking into this. You're going to feel the stretch right here in the buttock. There are a couple of extra little layers that you can add to this to give yourself more bang for your buck. One is to kind of push the knee and shin downward into the floor. So you'll kind of feel yourself lift up a little bit. Hold that for 5 seconds and relax, and then try to sink into it a little bit more. Okay? You're just thinking of that hip kind of coming up like that. And then you push down again, relax, and sink into it more. It's like your carriage is just sinking downward and kind of spreading the legs forward and backward. All right? Now, if you have tighter hips like me, you won't be able to sink way down into it like most people can. I've got my back straight, by the way. I'm not slouching forward. Don't make that mistake. Sometimes I'll use a foam roller to kind of help me get a little bit more leverage. Because basically what's happening here in the hip, again, that ball and socket joint, the socket's like this and the ball is like this. And your job, you're trying to stretch it up as far as you can into flexion of the hip, right? That bending up. It's a ball and socket movement. What you're going to do is you're going to use this roller to kind of push down here to really accentuate this. Okay, you're kind of going to use it as fulcrum. So I'll show you exactly how that works here. Again, we're trying to go like this. I'm in my position. For those of us who don't bend down quite as much, stick it right in there and feel the contact right here on that top part of the femur. And then in this case now, you can kind of let your torso sink into it. And you should feel a little more stretch happening here in the back. And you can even let your body kind of sink, and sort of oscillate. It's kind of hard to describe what I'm trying to do, but it's that ball and socket, and I'm just trying to push it down, push it down, push it down, push it down to get a little bit of an effect. You may need to shift around, kind of feel like what angle, side to side, is really getting you that sense of stretching in the back. But but you can just work it a little bit that way. If you feel like it's loosening up, get that back knee back a little bit more, still in line. Make sure that this is in, and just kind of oscillate, letting your torso weight sink down into the roller. Okay? So we showed you a couple of ways that you can stretch this. One being just getting into the pigeon pose. Then you can push down a couple of times for a 5-second hold with your leg and relax and try to sink into it a little bit more, like that. And then you also have the option of adding in a roller to just sort of push that top femur back, back, back to give yourself a little bit more flexion. So, my favorite part, let's recheck. Okay, here we are, coming up, 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 and right about here is where I stop. So I think that's a little bit better, okay? This is going to help us be able to sit, which is the main thing. It's going to help with all kinds of different movements. It's obviously going to help you be able to squat down. It's going to help you with running, even though you don't really bend up that much. Having the extra freedom of movement plays a big role in your stride. But the big one is being able to sit. People don't have the flexibility in the hips to bend up, and they need that. You need to have at least 90 degrees capability of bend here. Ideally, you've got more, 110 degrees, 120 degrees. You need to have that freedom of movement if you are to be sitting in a chair all day long, which a lot of us do. So this is a big one. Don't let this one go. Make sure you have this flexibility, you do this stretch. If you're not getting the flexibility, the problem is probably elsewhere in the body. You need to look up in the lumbar spine or the thoracic spine. We've got videos on how we treat those areas and get more flexibility in the hips. There's a lower thoracic spine treatment video where we demonstrate just by working on a little vertebra in here, hip bends up so much better without even touching the hip. So you've got to make sure that those areas are pretty good first. But yeah, this is another good one just to kind of supplement and make sure that you're maintaining the flexibility, being at your best performance and your best self.